Hi, and welcome to Cenario, your partner in mental wellness. Here on our channel, we share educational, insightful, and science-backed content to help you understand your mental health and take meaningful steps toward a more balanced life. If you're ready to learn, grow, and take control of your wellness journey, let's jump right in.
All right, let's talk about something that gets really misunderstood: obsessive compulsive disorder, or OCD. It's so often just a punchline about being neat and tidy, but it is so much more complex than that. Today, we're going to break it down using a really clear 4-pillar framework to help us all understand what's actually going on. Let's dive in. So, if you've typed this very question into a search bar, you are absolutely in the right place. This is probably the most common starting point for anyone trying to get a handle on OCD, and it's the big question we're going to answer right now. Here's how we're going to do it. First, we'll define that core cycle of OCD. Then, we'll get into the 4 main symptom groups, or pillars. After that, we'll look at the real-world impact of these symptoms, and we'll wrap up with what actually works: effective treatments and long-term management. Okay, first things first. Before we can even talk about the different types, we have to get to the very heart of how OCD works. Understanding this core loop is, well, it's everything. At its core, OCD is really a vicious cycle. It all starts with an obsession, this unwanted, intrusive thought that just barges in and creates a ton of anxiety. To get rid of that anxiety, the person performs a compulsion, which is a repetitive behavior. But here's the catch, the trap: that relief is super short-lived. This whole obsession-compulsion loop is the engine that drives every single type of OCD. So now, let's look at how that engine actually shows up in real life. While the symptoms can feel totally random, they usually fall into one of 4 main categories. We're going to call these the 4 pillars, because using this framework just makes a really complex condition so much easier to grasp.
Our first pillar is probably the one you're most familiar with. It's the one we see in movies all the time. This pillar is all about an intense fear of germs, sickness, chemicals, or even just a feeling of being dirty or polluted somehow.
And this is so important to understand. This isn't just about liking things clean. It's a compulsion that's completely fueled by anxiety. We're talking about washing your hands until they're cracked and bleeding. We're talking about avoiding parks or grocery stores for fear of what might be there. The goal isn't really to be clean. It's a desperate, exhausting attempt to feel safe.
The second pillar is driven by this really powerful and intrusive feeling of doubt. The main fear here is that you might have accidentally caused harm, or that you failed to prevent some kind of disaster. And that leads to a never-ending cycle of checking and rechecking. You can see how this doubt can just paralyze someone, because you can never be 100% sure. You get stuck. Leaving the house can turn into an hour-long ordeal of checking the stove, the locks, the windows. Sending a simple email might mean rereading it 20 times. It's this constant, draining search for a certainty that just never comes.
Now, our third pillar is a little different. This one is all about this powerful, overwhelming need for things to feel just right. This isn't always about cleanliness or even safety. It's about getting rid of an intense internal feeling of wrongness or incompleteness.
The compulsions here might look like arranging cans in the pantry until they feel perfectly aligned, or tapping a doorknob a certain number of times before leaving a room. It's not driven by logic, it's driven by this internal pressure. And if that just right feeling isn't achieved, or if someone messes up the order, the result is just this huge wave of anxiety and frustration.
This 4th pillar is often the most hidden and honestly the most misunderstood. It involves unwanted, deeply distressing, and often shocking thoughts about taboo subjects, things like violence or immoral acts or blasphemy. What is absolutely critical to understand here is that the compulsions are often totally invisible to other people. They're mental rituals like praying a certain way, or counting, or trying to cancel out a bad thought with a good one. And because of the incredible shame that comes with these thoughts, so many people suffer in complete silence, sometimes for years.
Okay, so those are the 4 pillars. But these aren't just neat little categories, right? They have a massive, massive impact on a person's day-to-day life. Let's take a look at what that actually feels like.
No matter which pillar we're talking about, the consequences can be huge. The rituals can eat up hours and hours every single day, which makes it incredibly hard to hold down a job, or stay in school, or maintain friendships. This constant internal battle, mixed with shame and the fear of being misunderstood, often keeps people from getting the help they desperately need. But, and this is so important, the story does not end there. There is highly effective, science-backed treatment out there. So now let's turn to the most hopeful part of this whole conversation, how people actually get better.
The gold standard treatment, the one with the most evidence, is a type of therapy called exposure and response prevention, or ERP. And you can see right here how it directly attacks that OCD loop. With a therapist's help, you gradually face a situation that scares you. That's the exposure. Then you make the incredibly brave and difficult choice to not do the compulsion. That's the response prevention. It's hard work for sure, but the goal is life-changing. You're teaching your brain through direct experience that the anxiety is a false alarm. You learn that it will go down all by itself without the ritual. You're basically rewiring that fear response.
Now, ERP is often used along with medication, usually SSRIs. A good way to think about it is like this. ERP is the hands-on training that teaches you how to break the OCD cycle. Medication, on the other hand, can help lower the overall volume of the anxiety and the obsessions, which can make it a lot easier to do the challenging work of ERP. For many people, using both together is the most effective path forward.
Recovery from OCD isn't really a one-time fix. It's more about building a set of skills for long-term management. So what does that look like day to day?
Well, this is basically the daily management toolkit. It means you keep practicing those ERP skills, maybe with planned exposures. It means actively working to resist that urge to ask for reassurance. And it also means building a solid foundation of self-care, sleep, exercise, nutrition, and having a plan in place with your therapist for when symptoms pop up again. Because just like any chronic condition, ongoing management is the key.
Before we wrap up, I want to tackle a really important question that people ask all the time. Do these pillars exist separately, or can you have more than one at a time? And the answer is a definite yes. Actually, it's extremely common for someone to have symptoms from more than one pillar. For instance, someone might have contamination fears that are paired with checking rituals. And this is exactly why getting a professional assessment is so crucial. So a therapist can create a treatment plan that's tailored to your unique mix of symptoms.
You know, at the end of the day, this is the main takeaway. OCD isn't just a quirky personality trait or a single behavior. It is a complex condition with many, many different faces. And recognizing that diversity is the first and most important step toward compassion, toward understanding, and toward getting people the right kind of help.
So we've walked through that core loop, we've broken down the 4 pillars, and we've looked at the real path to recovery. I really hope this framework has brought some clarity to a tough topic. And now the final question is for you. Now that you understand a little bit more, what's your next step? Maybe it's sharing this knowledge, maybe it's learning more, or maybe it's reaching out for support for yourself or for someone you care about. That step is yours to take. Thanks for listening.
Thank you for watching Cenario. If this video helped you, don't forget to like, subscribe, and share. For personalized mental wellness supplements, visit Cenario.com.